As of the latest statistics, colon cancer remains one of the leading causes of cancer-related deaths in the United States. Each year, it's estimated that tens of thousands of new cases are diagnosed, and thousands of lives are lost due to this disease. For the most current and accurate statistics, it's advisable to refer to reliable sources such as the American Cancer Society or the Centers for Disease Control and Prevention, CDC. Are you aware that early detection of colon cancer can drastically increase your chances of successful treatment? Recognizing the warning signs could save your life. Colon cancer is one of the leading causes of cancer-related deaths worldwide, but it doesn't have to be a silent killer. The early stages of colon cancer often present subtle symptoms that are easy to overlook or dismiss. By understanding and recognizing these early warning signs, you can take proactive steps to seek medical advice and catch the disease before it progresses. In this video, we'll walk you through the crucial signs and symptoms that you should never ignore. Your awareness and timely action can make all the difference. Let's dive into the signs that could help you stay ahead of colon cancer. Point number 1. Changes in bowel habits. A sudden and persistent change in bowel habits is one of the early warning signs of colon cancer. This can include shifts from your usual bowel patterns, such as experiencing diarrhea or constipation without an obvious cause. You might notice that you need to go to the bathroom more or less frequently than usual, or that the consistency of your stool has changed. These changes can occur due to a tumor obstructing the bowel, altering the normal passage of stool. If you experience any persistent changes in your bowel habits, it's important to consult with a healthcare provider for evaluation. Point number 2. Diarrhea. Persistent diarrhea that lasts more than a few days without a clear cause, such as a viral infection or food poisoning, could be an early sign of colon cancer. Diarrhea occurs when the colon cannot absorb water properly due to inflammation or a tumor disrupting normal function. If you notice frequent, watery stools that do not improve with time, it's essential to seek medical attention. Chronic diarrhea can lead to dehydration and other complications, so understanding its underlying cause is crucial. Early detection and diagnosis can make a significant difference in managing and treating potential colon cancer. Point number 3. Constipation. Chronic constipation, especially if it's a new and persistent issue, can be an early warning sign of colon cancer. Constipation occurs when bowel movements become infrequent or difficult to pass, often resulting in hard, dry stools. A tumor in the colon can obstruct the passage of stool, leading to constipation. If you experience a noticeable change in your bowel habits, such as frequent straining, infrequent stools, or a feeling that your bowel doesn't empty completely, it's important to consult a healthcare provider. Persistent constipation should be investigated to rule out any serious underlying conditions, including colon cancer. Point number 4. Blood in your stool. Noticing blood in your stool is a serious symptom that should never be ignored. Blood can appear as bright red streaks or cause the stool to have a darker, tarry appearance. This can be an indication of bleeding somewhere in the colon or rectum, often due to a tumor. While blood in the stool can also result from less serious conditions like hemorrhoids or anal fissures, it's crucial to have it evaluated by a healthcare professional to rule out colon cancer. Early detection of bleeding and its underlying cause can significantly improve treatment outcomes and overall prognosis. Point number 5. Bleeding from the rectum. Rectal bleeding is a concerning symptom and a potential early warning sign of colon cancer. This bleeding can manifest as bright red blood on toilet paper, in the toilet bowl, or mixed with your stool. While rectal bleeding can result from benign conditions such as hemorrhoids or anal fissures, it should never be ignored, especially if it is persistent or recurrent. Tumors in the colon or rectum can cause bleeding as they grow and disrupt the normal tissue. If you experience rectal bleeding, it's crucial to consult a healthcare provider promptly for a thorough evaluation and to rule out serious conditions like colon cancer. Early diagnosis and intervention can significantly improve treatment outcomes. Point number 6. Unexplained bloating or abdominal pain. Persistent bloating or abdominal pain that doesn't seem to be related to diet or other known conditions can be an early warning sign of colon cancer. Tumors in the colon can cause blockages, leading to a buildup of gas and pressure, which results in bloating and discomfort. You might experience cramping, sharp pains, or a constant dull ache in the abdominal area. These symptoms can be caused by a variety of conditions, but if they are new, persistent, or worsening, it's important to consult a healthcare provider. Early evaluation can help identify the cause and ensure timely treatment if necessary, potentially improving the prognosis for conditions like colon cancer. Point number 7. Feeling constantly tired. Feeling constantly tired, even after getting enough rest, can be a sign of anemia, which is often caused by chronic internal bleeding from a tumor in the colon. This persistent fatigue occurs because the body is losing blood, leading to a reduced number of red blood cells that carry oxygen throughout the body. As a result, you may feel unusually weak, lethargic, or short of breath. While fatigue can stem from various factors, when combined with other symptoms like changes in bowel habits or blood in the stool, it warrants a medical evaluation. Early detection and treatment of the underlying cause, such as colon cancer, can significantly improve outcomes and quality of life. Point number 8. Sudden weight loss. Sudden, unexplained weight loss is a significant warning sign that should not be ignored. Losing weight without trying, particularly when combined with other symptoms such as changes in bowel habits, blood in the stool, or persistent fatigue, can indicate a serious underlying condition, including colon cancer. Cancer can cause weight loss by altering the way your body uses energy, as well as by causing decreased appetite and nutrient absorption issues. If you notice a rapid drop in weight without a change in diet or exercise, it's essential to consult a healthcare provider promptly. Early investigation can lead to early detection and treatment, improving the chances of a successful outcome. In conclusion, recognizing these early warning signs of colon cancer is crucial for prompt medical evaluation and intervention. If you experience any of these symptoms, especially if they persist or worsen over time, do not hesitate to consult with a healthcare professional. Early detection can lead to early treatment and significantly improve your prognosis. Remember, taking proactive steps towards your health today can make a profound difference in your future well-being.